Hi, my name is Ariel and I am a grad student studying clinical mental health counseling, and I'm here to talk about systemic theories. And so that word can be used two different ways, and the first one is systemic theories is a grouping of what's called family systems theories or family systems therapies. And so as a whole, very generally speaking, systemic theories are, how can I say this? They don't see problems as within the individual. They see the problems that an individual may be facing as due to problems in society, problems in relating, problems in relationships. It includes the idea of that sort of we impact each other, society impacts us, we're all part of a microcosm and macrocosm. And so this type of therapy or therapies are generally used for families, couples, and can also sometimes be used in organizations and other types of groups. It's the main thing to know is that it's family oriented, it's group oriented, collective oriented. It's not individual focused. And so even if an individual were to come in for therapy, if they were seeing a therapist that practiced systemic therapies, this is my kitty, this is Luna, they would be seeing the client as within the greater context of society, family, culture often, although that's also in individual theories. And so they would never lose that view of this bigger context that impacts them. Okay, so there are 10 main family systems therapies. I've got my little list here in case I forget one. We've got the first one is MRI Systemic, and that stands for Mental Research Institute. And this was developed by a grouping of people. It's also called like the Palo Alto group in Palo Alto, California. And this one is the foundation for all other systemic theories. So that's when I said that the word systemic is used kind of in two different ways, as family systems therapies as a whole, and then there are specific therapies within that are called systemic, and this is one of them. The second is Milan Systemic Therapy, and that was developed not long after MRI by what was also called the Italian group. They kind of took what was developed at MRI and added some of their own take to it. Next is strategic therapy. Then we've got structural therapy, followed by Satir's human growth model. Satir's model is particularly interesting because it takes into account both systemic perspectives as well as individual perspectives, so it's got some good balance to it. Followed by Symbolic Experiential Therapy, Internal Family Systems Therapy, or IFS. That's very common nowadays. It's a great technique. Bowen Intergenerational, and narrative therapy. That's something that I will definitely go into in another video. Collaborative therapy, which was actually developed right here in Texas. And then sort of a bonus one is emotion-focused therapy, also called EFT. So why I said it's a bonus is because it's an integrative theory that uses systemic theory along with several other theories. It includes attachment theory, person-centered, and existential, if I remember correctly. So I'll have to go that one in another video as well. So I hope that you enjoyed learning about what systemic family systems theories are and what systemic theory is. So basically, in essence, it means, I like to think of it kind of as like a spider web where you can see, you begin to piece together that things are connected to each other. I impact you, you impact me, we impact someone else. We're part of a system, particularly in a family, right? So I hope that that was helpful, and let me know if you guys have any questions. Have a good day.